Hello sir, good day. I am Nina Claro, a student nurse from St. Paul University. Before we start the assessment, can you please state your name?
Ryan Clara.
When was your birthday, Sir Ryan?
May 19, 2000.
Okay, so Sir Ryan, for today's assessment is I'm going to assess your lungs and thorax. It is very important for us to know our thorax and lungs condition because it provides a clues about our general health condition. If there would be any abnormalities and negative findings, rest assured that all of the gathered information will be remain confidential between me, you, and the attending physician that I'm going to refer to. Before I start, sir, I'm just going to perform a medical asepsis to prevent the spread of microorganisms. I'll just wear my gloves. I'll just close the curtain, sir, for your privacy. Okay, sir, so are you comfortable with your position? Okay. Before I start to conduct the procedure, sir, I'm just going to ask you a few questions about your past health history or if there would be any history in your family. So, sir, is your family has a history of cancer?
Yes.
How about allergies, sir? Do you have allergies?
Yes.
What allergies, sir?
Rhinitis.
Okay. So, how about tuberculosis, sir? In your lifestyle, sir, do you smoke cigarettes? How about vaping? Okay. In medication, sir, do you take any medicines? Do you have any current problems? Swelling, coughing? Okay. So let's proceed. Let's proceed to the posterior thorax. And the first thing that I'm going to do is I'm going to inspect the shape and symmetry of the thorax from posterior and lateral views. So sir, can you please sit? Show me your back. Okay, so sir, I can see that your thorax is symmetric. I also observe and see that the anterior posterior ratio to the transverse ratio is 2 to 1. Okay, next is I'm going to inspect your spinal alignment to see if it has or if it has a deformities. Can you please stand up, sir? Turn your back to me. Okay, sir, so as I can see, your spinal is vertically aligned. Before we proceed to the next procedure is, I'm going to ask you if you have any difficulty in respiration. Okay. How about tenderness? Do you feel any pain? Unusual sensations? Muscle soreness from excessive work of breathing? Okay, so none. So if there would be any of this, I'll proceed in assessing your temperature. Turn your back to me, sir. I'll be using the dorsal part of my hands. Okay, so sir, your temperature is not too hot, it is not also too cold, it is warm, which is normal. The next thing that I'm going to do, sir, is I'm going to palpate the posterior chest for respiratory excursion or the thoracic expansion. I'm going to place both of my palms in your lower thorax using my thumbs. Is that okay with you, sir? Okay. Turn your back again with me, sir. Sir, can you please breathe in? Breathe out. Again, sir. Breathe in. Breathe out. Breathe in. Okay, so sir, as you deep breath, my thumbs move 3 to centimeters symmetrically, and it is very nice, normal, and good. Next is I'm going to palpate the chest for vocal tactile Permeates. Can you please turn your back again, sir? Can you please cross your hands, Sir Ryan? Okay. As I touch your back, sir, can you please say 99? Okay?
99. 99. 99. 99.
Okay, so Sir Ryan does not have any Permeates. Next is I'm going to percuss your thorax. Sir, just turn your back. And the next thing that I'm going to do is I'm going to percuss your thorax